Hello. My name's Neil Smith. I'm a Kallmann syndrome patient living in the United Kingdom. I'm in my 50s now, but I was diagnosed when I was 23 years old when I was working in London. I try to work as a patient advocate. I like talking to fellow patients and trying to improve or increase the knowledge of the condition and try and help patients learn more about the condition and hopefully learn more myself about the condition. And I like talking to patients, but increasingly it's very helpful to be able to talk to healthcare professionals in the United Kingdom and America who are specialists in this condition. And today we're going to talk to Andrew Dwyer, who's a specialist in America. I've worked with Andrew a few times over the past few years. He's been very helpful, and it's a pleasure to be able to speak to him today.
Thanks so much, Neil. My name's Andrew Dwyer. I'm an associate professor at Boston College in just outside of Boston, and I'm an investigator at the Massachusetts General Hospital. So we're here to answer some common questions about congenital hypogonadotropic hypogonadism, or CHH, also known as Kallmann syndrome. And this is informational. It's not intended to be provide medical advice, but we'd like to respond to some of the frequent questions that patients have.
I think I found with Kallmann syndrome, it's a very difficult condition to diagnose. I myself was diagnosed when I was 23, and when I talk to fellow patients, that seems to be quite a common age between like 19 and 24 seems to be fairly common age for people to diagnose. I know people are diagnosed earlier or even later. Just want to see what makes this condition more difficult than others to diagnose.
Yeah, it's a really good question. It's not uncommon. It's unfortunate, but it's not uncommon that individuals are diagnosed late in adolescence or early in their 20s, much like you were. Unfortunately, that can have a lot of consequences, both psychologically, and it can be really frustrating to go to the doctor's office or see a healthcare professional and know that something's not quite right and not have an answer. So it's hard to diagnose because there are many people who experience delayed puberty. So they go through puberty normally, but they just do it later than their peers. But they go through and complete puberty normally. In patients with Kallmann syndrome or CHH, they won't complete their puberty ever. So oftentimes it's diagnosed late because people just assume that it's delayed puberty. They will say, oh, it's just a late bloomer. They'll go through puberty on their own. But unfortunately, often that gets extended and then people aren't diagnosed until late in their adolescence or in their early 20s.
I myself was labelled as a late bloomer. Um, I was first sent to my GP when I was about 15 by the school nurse after an examination for a paper round where you had to do a health check. And I had an examination. She sent me to my GP, and the GP said, no problem at all. You're just a late bloomer. Go away. I don't need to see you again. Just wait and see a couple of years. You'll be fine. And I waited 16, 17. I perhaps saw my GP once a year at 16 or 17, and every time it was, oh, you're a late bloomer, wait and see. I think it was 18 when I first was sent to a specialist, but it was a general medicine specialist and a urologist. I was not even sent to see an endocrinologist at all. And I think that delayed my diagnosis a lot because I was just labeled a delayed late bloomer and just wait and see.
Yeah, it can be really frustrating. And unfortunately, we don't have a great test to differentiate people from who have simple delayed puberty and will go through puberty on their own, albeit later, or to differentiate from Kallmann syndrome or CHH. There's some really interesting work and research being done right now using different types of tests, like using a molecule called kisspeptin to try to help differentiate delayed puberty from Kallmann syndrome. But right now we don't have great tests, so oftentimes it's difficult to differentiate. But there are some signs that can point to a diagnosis of Kallmann syndrome and help accelerate when we detect folks and start treatment earlier, which is really, really important.
When I was at school, it was noticed I had poor hearing, so I should have worn a hearing aid at school, and I had no sense of smell. And no sense of smell did not bother me at all at the time. I don't even remember if I mentioned it to the doctor. But these two symptoms together, I now know, are red flag symptoms that could have led to an early diagnosis. My lack of poor hearing and the lack of sense of smell. But no doctor at the time I saw before the age of 23 seemed to link those to my delayed puberty.
Yeah, I mean, when you say the no sense of smell, that's also called anosmia. And that is what we call a red flag, which can point to a diagnosis or support a diagnosis. The other things are sometimes detected very shortly after birth. If a male infant has undescended testes, so the testes are not down in the scrotum, or has an unusually smaller phallus size called micropenis, those can be indicators that the hormone levels were not quite right when the baby was developing, and that can be observed early at birth. But during childhood, you could measure someone's hormone levels, and a male during childhood will have very low hormone levels. So measuring a blood test during childhood is not something that's effective. However, if somebody's not starting puberty, and typically we expect to see the first onset of puberty at around 14, if somebody's not starting, then we can really watch and do some further investigation. And if somebody's not progressing by 14, 15, there's a pretty good likelihood that something is going on. Now, there's some additional things we can think about: no sense of smell, or that history of undescended testes. Sometimes that's called cryptorchidism. And then we can also think about potentially using a genetic test to help identify people who are at risk for having Kallmann syndrome or CHH.
My childhood was very normal. I didn't feel any different. I didn't notice any different. I went through school quite normally. It was only at the age of puberty, well, we should have started, all my friends started developing, and I was just left waiting every day or every night. I thought something will happen soon, something will start, and nothing started. And it was quite, I don't say traumatic, was at the time I didn't feel bad. It's only with hindsight it made it worse. But at the time I was just believed in what doctor said, just wait and see, and I just waited. And wasn't until after university that I got a diagnosis and started treatment.
Yeah, so unfortunately, that story of kind of what we call a diagnostic odyssey, waiting a long time to get a proper diagnosis, can be really distressing for people. And many folks, I've heard many stories like yours, Neil, where people say, well, I was just waiting for something to happen and they told me it was going to happen and it didn't. So that can be really frustrating. And what we're trying to do is kind of raise awareness. But CHH and Kallmann syndrome are rare diseases. So many people don't know about them. The main thing I think to think about is if somebody is not progressing normally through puberty, really go for an evaluation. And if there's a suspicion that there's something going on, sometimes that's really warrants a referral to a specialist, an endocrinologist, who may have a little bit more insights. And that's kind of the person who first diagnosed you.
Are there any other symptoms that can be associated with Kallmann syndrome, CHH? I myself had the anosmia and the poor hearing, but are there any other so-called red flag symptoms that could be looked for?
Yeah, there are many things that can be associated with Kallmann syndrome, but they aren't always. So there are some things like some people have hearing loss, some people have no sense of smell, some people have some differences in their musculoskeletal system in terms of their bones or their fingers. Sometimes there are differences in teeth, extra teeth or missing teeth. Some people have a midline defect, such as a cleft lip or cleft palate. And some people may have synkinesia, which is kind of what we call a mirror movements, and that's a neurologic sign. And some people are born with only one kidney. So there's a very wide range of things that can present with CHH and Kallmann syndrome, but that doesn't mean that everyone has them. They're often highly variable, meaning that not everyone has these signs, but there are a number of things. Really, anosmia is the one that really stands out to us. If somebody doesn't have a sense of smell and they don't have an onset of puberty, that should really indicate, wow, this person may have Kallmann syndrome and they should really be evaluated. So we hope that you found this information interesting and useful, and we hope that you'll continue to watch other videos in this series. So thanks for joining us.
Okay.